And we all know, and you mentioned how important it is a primary care in the system. Why do you think many countries like Brazil can't have a structured and well-designed primary care system working in benefit of the entire system? What do you think? Why that happened?
I think it's history, and I think it's routines. I think when you haven't had a strong primary care system from the beginning, people tend to think, if I'm ill, I need to go to the most well constructed, to the most well set setting, so that I can achieve best care there. What people tend to forget is that you don't need that setting. If you have a little fever and nothing more, you don't need to go to a hospital. You don't need to go to see an internal doctor. But I think from the fact that you don't have originally, historically, a strong primary care setting, there is, I think it's very much an attitude saying, oh, if there's something wrong with me, please go to a hospital, because there is everything that can be needed in case of crisis. And I think it's that attitude that makes it very difficult, and you have to really start working with the public. And we've been doing that in quite a lot of settings. In my home country, the Netherlands, we really worked very hard, because we had a tendency there where people tended to go more and more to the hospital, and we were able to revert that. We had to work on it. We used incentives for it, like where do you have to pay and where don't you have to pay in terms of co-payments. And by doing that, we could redress people back to the primary care settings. And what we also did at the same time is that within the primary care setting, we looked at subspecialties. So you will have larger groups of GPs working together, and one would focus a little bit more on the problems of the elderly. The other ones would focus a little bit more on mental health problems or on diabetes. And that way is strike a very good balance between what they can do, widening the array of services that they can deliver, and keep them at a very high level. But I think in countries like Brazil, it's really, and you can see that, by the way, in the US as well, it's systems where people tend to go very quickly to the most expensive settings. And it's a cultural and an attitude problem. And you need to readdress that. You need to inform people. You need to educate them in that. And you need, first of all, to build up a very strong primary care setting.
Yeah, it brings to me two words, behavior and engagement.
Yes.
And it's all about people at the end.
Yeah.
Because
yeah.
people, they have their own behavior, and they have, the engagement. That's really interesting. And another thing linked to this discussion is the difference between the private and the public sector. Even though, to me, primary care has to be on both. Perhaps for the public is more urgent because of budget constraints, etc. But we don't see many changes or movements on that direction. So I don't know your perception on that, considering public and private segments or sectors having that discussion on primary care.
It seems like Brazil is still trying to find the right role of the private sector in a country that is committed to universal healthcare coverage.
Yeah. I have worked in countries which have public system, I have worked in countries that have private system, and I have worked in countries that have mixed systems. And to be honest, I don't think, of course your way of funding healthcare is different, but I think that in terms of the care delivery model, I don't see the necessity of any major differences in your care delivery model in private systems or in public systems. Both should have a very strong primary care setting to keep people away from using the very expensive settings and from people using very expensive services. So be it public, be it private, you need a very strong primary care setting. And by doing that, you can save your money to have the Secondary and tertiary care really put that at a very high level of, competences, specialized knowledge, specialized intervention. So I don't think that's split. I think that's split, but sometimes I feel that privately insured patients see it as their right and as the extra that they can go to the hospital directly, rather whereas public patients have to go to the primary setting. In my country where I come from, we have a private system, but everybody goes to their primary doctor. And it's not being seen as something which is less, it's seen as something that is adequate for less complicated demands.
Yeah, that's interesting because again is behavior and engagement. But I was exposed to one situation where we were discussing access, and it was a private, and the discussion was, let's have a GP following a group of patients, and one of the persons said, no, that we are going to prohibit on the patient's view access, because we are trying to coordinate the access of that patient to the network, to the system. And see, this is again change management. That's behavior, and that's a cultural kind. So, and I fully agree. I heard once that we that have private insurance, we have an unlimited credit card, and that's the problem of the system.
Yeah, that's the problem.
We spend without conscious.
Yeah, I think it's educating your population. Let's be clear about it. The price of your private insurance also depends on the way in which, on the efficiency with which you design your system. So if you have all your patients that are insured with your private insurance company, if you all have them going to the most expensive setting, using the most expensive services, your premiums will be higher. And that's what I love about the Israeli system. They've got 4 insurance companies, private, not for profit, and they are in a very strong competition on delivering high quality care at low cost. And they are very creative in finding the solutions for that. So people, even private patients, need to realize that if they have consumption patterns of using those expensive services, they will be paying for them themselves. So they might think they have an unlimited credit card, but they're paying for it.